Before you give a rehab center your insurance information, ask these questions. If you are calling a substance use treatment center today, you are likely overwhelmed. You may be scared, exhausted, desperate for help, and that makes sense. But before you give anyone your insurance information, pause for just a moment. There are a few important questions you should ask first. Not because treatment doesn't work, but because not all programs are the same. And once your insurance is verified, you may feel emotionally committed. So here are 5 questions to ask before moving forward. Question 1. What evidence-based treatments do you use? Listen for specific names: motivational interviewing, cognitive behavioral therapy, contingency management, trauma-specific therapies. If they cannot name approaches that are supported by research, ask them to explain their model clearly. Hope is important, but treatment should also be grounded in science. Question 2. How do you assess and treat trauma? Many individuals with substance use disorders have a history of trauma. If trauma is not assessed, it often goes untreated, and untreated trauma can increase relapse risk. Ask whether trauma screening is standard and what therapies are offered if trauma is present. Question 3. How do you measure long-term outcomes? Be cautious of answers that focus only on completion rates, client satisfaction at discharge, or how hopeful people feel when they leave. Those things matter. But the more important question is, what happens at 6 months? At 12 months? Do they track that? Real recovery is measured over time. Question 4. Who will be overseeing medical care? If medications like methadone or other opioid treatments are involved, ask how medical monitoring is handled. Are physicians involved? Are safety protocols followed? How are side effects monitored? Medication can be life-saving, but it should also be medically supervised carefully. Question 5. Who will I be speaking with about clinical decisions? Often your first contact is a marketing or admissions representative. That is normal, but before committing, ask to speak with a clinical professional about treatment planning. You deserve informed consent. You deserve clarity. Here's why this matters. When families call treatment centers, they are often at their most vulnerable. In that moment, reassurance can feel like competence. But calm questions protect you. Asking thoughtful questions does not mean you lack hope. It means you are protecting it. Take 60 seconds. Write these questions down. Then make the call. Hope and informed decision-making can go together, and your loved one deserves both. This information is for educational purposes only and is not a substitute for medical or legal advice. Always consult with qualified healthcare professionals regarding treatment decisions.